You know what? In my more than 20 years as a urologist here in Singapore, I cannot even count how many times patients walk into my clinic at Mount Elizabeth or Tan Tock Seng, sit down looking all paise, and then struggle to ask me questions about masturbation and prostate health. Some of them, especially the older uncles, they whisper like they scared the whole waiting room can hear. And I always tell them the same thing lah, there is nothing to be embarrassed about. This is your health we are talking about. So today I want to have a very honest conversation with all of you about something that many men experience but very few want to discuss openly. We are going to talk about what actually happens to your prostate when you masturbate regularly, and I mean daily. Some of the changes are actually beneficial, but some of them you really need to watch out for. So stay with me because this information could genuinely make a difference for your health. First thing first, let me explain what the prostate actually is, because you will be surprised how many men do not really understand this small but very important gland. Like, the prostate is about the size of a walnut, sitting just below your bladder and surrounding your urethra, which is the tube that carries urine out of your body. Now, this little fella is responsible for producing a significant portion of your seminal fluid, the liquid that transports and protects your sperm. Without a healthy prostate, your reproductive system simply cannot function properly. And here is the thing that many people do not realize: the health of your prostate is closely connected to your sexual activity, including masturbation. So when we talk about what happens when you masturbate daily, we are really talking about how this activity affects this crucial gland. Let me share with you the first change that happens, and this one is actually quite positive. When you masturbate regularly, your prostate undergoes what we call functional improvement and adaptation. You see, every time you ejaculate, your prostate plays an active role by secreting fluid into your urethra. When masturbation becomes a daily practice, your prostate enters a regular cycle of production and secretion. This constant stimulation can actually lead to an adaptive response, improving the efficiency of the gland. It increases its fluid production to meet the higher demand, making sure that each ejaculation is accompanied by adequate seminal fluid. Now, this increased activity is generally not harmful, but it can have some physical effects. Through frequent stimulation, there may be temporary enlargement of the prostate, which is quite common. Although this hypertrophy is generally harmless, it can cause a feeling of pressure or fullness in the pelvic area, especially if the gland does not have time to recover between ejaculations. Over time, this cycle of increased activity and recovery establishes a new normal for the gland as it adapts to daily stimulation. I remember one patient of mine, Uncle Tan, 72 years old, came to see me at my Novena clinic last year. He was worried because he felt this fullness in his lower abdomen after he started becoming more sexually active following his retirement. I told him, Uncle Tan, this is actually your prostate doing its job lah. Nothing to worry about as long as there is no pain or difficulty urinating. The second change involves temporary swelling and what we call hemodynamic changes. Frequent masturbation can lead to temporary changes in the size and sensitivity of the prostate. During arousal and ejaculation, blood flow to the pelvic area, including the prostate, increases significantly. This increased blood flow causes the gland to swell slightly, which is a natural response to heightened activity. After ejaculation, the prostate does not quickly return to its pre-arousal state. The process of reducing blood flow and relieving built-up tension takes some time, leading to a phase of sustained swelling. For men who masturbate daily, this swelling may not be noticeable, although it clearly signifies the active involvement of the gland during sexual activity. Repeated cycles of swelling and relaxation can cause the prostate to become more sensitive over time. Some men may experience a slight throbbing in the pelvic area or a feeling of fullness after ejaculation. Although this is not harmful in itself, it is important to monitor these sensations. Persistent or painful swelling may indicate an underlying condition such as inflammation or irritation that requires medical examination. If you experience this kind of thing, please do not shy. Just come and see a doctor straight away. Now here comes the third change, and this one is actually very good news for many of you. One of the key benefits of regular masturbation is improved prostate drainage. Ejaculation is a natural process that allows the gland to expel the fluids it produces. Without regular ejaculation, these fluids can accumulate, potentially leading to discomfort or an increased risk of infection. Daily emptying of the prostate helps men maintain gland hygiene and reduces the risk of conditions such as prostatitis. Prostatitis is characterized by inflammation of the prostate, which can cause pain, urinary complications, and fever. And here is something that might surprise you. Research suggests that regular ejaculation may reduce the risk of prostate cancer by expelling toxins and other potentially harmful compounds that could accumulate in the gland. Let me share some actual research with you because I know some of you are skeptical. A major study published by Harvard Medical School followed nearly 32,000 men over 18 years. The researchers found that men who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times monthly. We are talking about a reduction of about 20% in prostate cancer risk. That is not a small number, people. Now, I want to address something that came up from a viewer's question that really touched my heart. One gentleman shared that he had been abstinent for 5 years due to severe illness, and now he is facing elevated PSA levels and suspected tumors. He asked whether his abstinence could be the cause. Look, I cannot give specific medical advice without examining a patient, but I can tell you that while regular ejaculation appears to have protective benefits, cancer development is multifactorial. It involves genetics, diet, environmental factors, and many other things. So if you are in a similar situation, please do not blame yourself. The most important thing is to work closely with your urologist for proper diagnosis and treatment. However, a delicate balance must be maintained here. While regular drainage is beneficial, excessive practice can put unnecessary strain on the prostate. The continued production and secretion of fluids by the gland without adequate recovery can lead to fatigue and even mild inflammation over time. Good hydration and a diet rich in prostate-friendly elements such as zinc, vitamin D, and omega-3 fatty acids can support gland health, especially for men who ejaculate regularly. Here in Singapore, we are lucky to have access to good seafood like salmon and mackerel, which are rich in omega-3. And for zinc, you can eat more shellfish, nuts, and seeds, very easy to find at any NTUC or wet market. The fourth change relates to prostate sensitivity and hormonal regulation. Daily masturbation has not only physical effects on the prostate, but also affects its hormonal environment. The prostate is responsive to male hormones such as testosterone and dihydrotestosterone, also known as DHT, which influence its growth and function. Frequent ejaculation can lead to minor fluctuations in hormone levels as the body responds to increased sexual activity. In some men, these hormonal fluctuations can increase prostate sensitivity. This heightened sensitivity may manifest as increased perception of sensations in the pelvic area or slight discomfort after intense physical activity. For men with pre-existing conditions such as benign prostatic hyperplasia, which we commonly call BPH, this sensitivity may be more pronounced. Additionally, hormonal fluctuations can affect the consistency and composition of seminal fluid. Some men who masturbate daily may notice changes in the thickness or quantity of their ejaculate, which is directly related to prostate activity and hormonal regulation. Although these changes are generally harmless, they deserve attention as part of the broader context of gland adaptation to daily stimulation. Now, I want to take a moment to address some of the myths and old wives' tales that I still hear from patients, especially the older generation. Some of you might have grown up hearing that masturbation will make you go blind. While I cannot tell you how many times I heard this one, let me be very clear. There is absolutely no scientific evidence linking masturbation to vision problems. Zero. None at all. Another common myth is that you have a limited number of ejaculations in your lifetime, like some kind of quota system. Your body continuously produces sperm and seminal fluid throughout your life. There is no 3,000 shot limit or whatever number your mother or grandmother might have told you. And no, masturbation does not cause hair to grow on your palms, it does not cause a crooked spine, and it does not automatically mean you have a psychological problem. These are outdated beliefs that have been thoroughly debunked by modern medicine. What matters is moderation and listening to your body. The fifth change is something I call prostate fatigue, and this is where things get a bit more concerning. For men who masturbate daily, the prostate and adjacent structures go through a cycle of constant stimulation and recovery. The prostate is highly adaptable, but sustained stress can lead to what I describe as prostate fatigue. This condition does not manifest suddenly but develops gradually as a repetitive cycle of seminal fluid production, swelling during arousal, and contraction during ejaculation takes its toll.
One of the main indicators of this fatigue is a prolonged recovery period after ejaculation. Men may notice that their orgasms are less intense or less satisfying, suggesting that the prostate and pelvic muscles are not fully recovering between ejaculations. Additionally, a feeling of dull pain or mild discomfort in the pelvic area, especially after multiple masturbations, may become more pronounced. Prostate fatigue can also affect urinary habits. The gland surrounds the urethra, and any irritation or inflammation can lead to temporary changes in urine flow, including a reduction in stream strength or an increase in urinary urgency. Although these symptoms often resolve on their own with rest, they emphasize that the prostate, like any other organ in the body, needs to be treated in moderation. I had another patient, a retiree, who came to see me complaining that going to the toilet was becoming troublesome. After chatting with him, I found out he had been masturbating 2 to 3 times daily since his wife passed away.
I explained to him that his prostate needed rest, just like how after you run a marathon, your legs need time to recover. Once he reduced his frequency and gave his body more recovery time, his urinary symptoms improved significantly within a few weeks. The sixth change involves the risk of irritation or inflammation. Another effect of daily masturbation is the possibility of mild irritation or inflammation of the prostate, especially if the activity is intense or prolonged. During ejaculation, the prostate contracts forcefully to release seminal fluid. Frequent repetition of this process can lead to increased sensitivity or irritation of the gland. Prostate inflammation can manifest in various forms. Some men may experience a persistent feeling of fullness or pain in the lower abdomen or perineum, which is the area between the scrotum and anus. In some individuals, there may be a mild burning or tingling sensation after ejaculation, indicating possible overstimulation of the gland. In some cases, this irritation can develop into prostatitis, an inflammation of the gland that can lead to more serious symptoms such as pelvic discomfort, difficulty urinating, or fever. Although prostatitis is primarily associated with bacterial infections, non-bacterial variants of the condition can sometimes be linked to lifestyle factors such as excessive stimulation of the prostate. To reduce the risk of irritation, it is essential to masturbate with care. Adequate lubrication, avoiding overly vigorous methods, and allowing recovery time for the gland can help protect the prostate from excessive stress. If discomfort persists or worsens, it is imperative to see a doctor to rule out possible underlying conditions. Here in Singapore, you can go to any polyclinic for a referral to a urologist, or if you prefer, you can see a specialist directly at private hospitals. Do not let embarrassment stop you from seeking help, okay? Now let me address another question I often receive. Yes? Does it matter whether you ejaculate through masturbation or through sexual intercourse with a partner? This is actually a very good question. And the answer is that from a purely physiological standpoint, the prostate does not really distinguish between the two. The mechanical process of ejaculation and the drainage benefits are similar whether you are masturbating alone or having sex with a partner. However, there are some differences worth noting. Sexual intercourse often involves more overall physical activity, which can have additional cardiovascular benefits. There is also the emotional and psychological aspect of intimacy with a partner, which can reduce stress hormones and potentially have positive effects on overall health. But if you are single or your partner is unable to engage in sexual activity for health reasons, please know that masturbation provides similar benefits for your prostate health. The key is regularity and moderation. The seventh change concerns hormonal effects on prostate function. I mentioned hormones earlier, but let me go deeper into this topic because it is really important. When masturbation becomes a daily practice, the body adapts by fine-tuning its hormonal mechanisms. This can lead to changes in seminal fluid production as the prostate and seminal vesicles work harder to keep up with demand. Men may notice changes in the consistency or volume of their ejaculate, reflecting fluctuations in gland activity and hormonal balance. Over time, these hormonal changes can also affect prostate sensitivity. Some men may experience more intense orgasms, while others may feel less pleasure due to heightened gland activity.
Additionally, repeated ejaculation can lead to a temporary decrease in testosterone levels as the body works to replenish its hormonal reserves. Although these changes are generally insignificant and reversible, they underscore the need for balance.
Maintaining optimal hormonal balance through proper nutrition, regular exercise, and effective stress management helps support prostate health and functionality even with frequent use. Finally, let us consider the long-term effects on prostate health. As I mentioned earlier, regular ejaculation has been linked to a reduced risk of prostate cancer. This protective function is based on the prostate's ability to expel dangerous compounds, including carcinogens, through repeated ejaculations. Research shows that men who ejaculate frequently, whether through intercourse or masturbation, have a lower risk of developing prostate cancer over their lifetime. However, the benefits of regular ejaculation must be weighed against the potential dangers of excessive practice. For men with pre-existing conditions such as BPH or chronic prostatitis, regular masturbation may worsen symptoms including urinary problems or pelvic discomfort. Additionally, accumulated strain on the gland over time can lead to chronic inflammation or increased sensitivity. To maximize benefits while limiting risks, you need to follow a balanced approach. Pay attention to your body's signals, incorporate rest days, and consult healthcare professionals when needed. This can help maintain prostate health and strength. The prostate is a remarkable organ that meets the demands of regular ejaculation while playing an essential role in male reproductive health. Daily masturbation can have benefits such as improved drainage and reduced cancer risk, but it can also cause problems such as discomfort, sensitivity, or fatigue if not properly moderated. Maintaining a healthy prostate requires more than just moderation. A nutrient-rich diet with zinc, selenium, and omega-3 fatty acids can improve gland function. Regular exercise and adequate water intake promote overall well-being. Equally important is paying attention to the signals your body sends. Discomfort, altered urinary habits, or reduced intimate satisfaction should not be ignored. So to summarize everything for you, moderate and regular ejaculation appears to be beneficial for prostate health. Listen to your body and take rest days when needed, eat well, stay hydrated, and exercise regularly. Do not believe the old myths about masturbation. If you experience persistent pain, urinary changes, or any concerning symptoms, please see a doctor promptly. And remember, there is no shame in discussing your sexual health with a medical professional. We have seen and heard it all before. Trust me. Before I end, I want to remind everyone, especially those of you above 50 years old, please go for your regular health screenings. A simple PSA blood test can help detect prostate problems early. Here in Singapore, you can get this done during your Screen for Life program at the polyclinics. Early detection really can save your life. I hope this information has been helpful for you. If you found this video informative and would like to learn more about men's health topics, do not forget to like, share, and subscribe to my channel. Your support allows me to continue creating comprehensive and useful content that empowers you to manage your health effectively. If you have questions, just drop them in the comments below, and I will try my best to address them in future videos. Take care of yourselves, gentlemen, and remember, your health is your wealth. Until next time, this is Dr. Cheryl Lim reminding you to prioritize your health always.